twisted cords, busted members, and the 4-hour horror nobody wants to talk about. Some are rare, some are common, and all of them downright excruciating. Today, we're breaking down the 5 most painful things that can happen to the male body. Let's dive right in, shall we? Number 5, testicular torsion. This first one brings a whole new meaning to twist and shout. In fact, it's the nightmare fuel of teenage boys everywhere, and for good reason. And it happens when the spermatocord, aka the collection of vessels, nerves, and ducts that run to and from the testes, twists, cutting off the blood supply to the testicle. We're talking sharp stabbing pain that radiates from the groin into the lower abdomen and back. Some guys even report nausea, vomiting, or stomach cramps to accompany the pain. So what causes testicular torsion? Sometimes it's caused by trauma, other times you just simply roll over in bed weird and boom. Statistically, about 1 in every 4,000 males under the age of 25 will experience this. In other words, it's more common than you think, and it can have a hereditary component, a condition called bell clapper deformity, which allows the testicle to rotate more freely, is often inherited and increases the risk of testicular torsion. While not everyone with this genetic predisposition will develop torsion, it does suggest an inherited increased risk. And symptoms come on fast. One testicle swells, pain spikes out of nowhere, and walking becomes a challenge. The worst part, you've got about 6 hours to get treated before the tissue starts to die. After that, we're talking about potential removal and permanent fertility damage. As they say in the emergency medicine business, time is testicle. If you're thinking you have a testicular torsion, it's not something to wait out and see. Err on the side of caution and get to the emergency department ASAP. Number 4 most painful thing, kidney stones. Ever thought about trying to pee out a rock? Welcome to the humbling world of kidney stones, the sharpest, most unwanted surprise your urinary tract will ever get. Kidney stones form when minerals in your urine crystallize. They can be as tiny as a grain of sand or as large as a marble, but either way, they've got to travel through the ureter, that narrow tube connecting your kidney to your bladder, and yes, they hurt exactly how you'd expect. If you've never had one, imagine a tiny, jagged boulder scraping its way down a drinking straw inside your body. Ouch. Doesn't even cover it. And before anybody comes for me in the comments, yes, women can absolutely get kidney stones too. But here's the kicker. Men are more likely to get them, especially between the ages of 30 to 60. Body chemistry, diet, and hydration habits. Men also tend to have a longer urethra, and while that may not sound like a big deal, it can mean the stone has a longer, more painful path to freedom. Just something to think about next time you skip that glass of water. In fact, about 1 in 10 people will develop a kidney stone at some point in their lives. How do we treat these jagged little nightmares? That depends on the size. Small stones? Pain meds, fluids, and unfortunately, just time. You've got to let it pass naturally, which can take hours or days. Larger stones, that's when we bring in the tech. Shockwave therapy to break it apart, or in more severe cases, surgical removal or ureteral stents. Number 3, male-oriented pain, priapism. Let's talk about the warning label you've definitely seen but probably ignored. Seek help if your erection lasts more than 4 hours. You know the one. We've all heard it on those commercials, and it's not just awkward, but it's also very dangerous. What is this weird medical term? Priapism, put simply, is a prolonged, painful erection not typically related to arousal, and it happens when blood gets trapped in the penis and can't drain out. The pressure builds up fast and the tissue starts to swell. Let me paint a picture for you. Have you ever smashed your finger and the blood fills up? You get that deep, pounding, throbbing pain that doesn't stop? Well, that's sort of the feeling of priapism, but this time the pain is headquartered in the penis. If you don't fix it in a timely manner, the tissue can literally die, leading to permanent damage. What triggers this condition? First, being ED meds like Viagra or Cialis. Additionally, blood disorders like sickle cell anemia or the use of certain recreational drugs can also cause it as well. Although there is typically fewer than 5,000 cases per year in the US, according to some statistics online, I'm not sure if I entirely agree, because in my professional career, I've seen it more often than you think, and when it happens, it's usually unforgettable for the patient more so. Treatment typically begins with ice packs and medications to constrict blood vessels, but in more severe cases, we as emergency room doctors have to drain the blood with a needle or multiple needles directly into your penis to drain it out. Number 2, penile fracture. Just when you thought breaking a bone was the pinnacle of pain, there's another lesser known ticking time bomb lurking for some men, the dreaded penile fracture. I know what you're thinking. Can you even break it? And the answer is, unfortunately, yes. Even though there's no actual bone in the human penis, you can still do some serious damage. The penis contains 2 spongy tubes wrapped in a membrane called the tunica albuginea. If the penis is fully erect and suddenly bent, that membrane can tear. It's usually accompanied by a pop sound, immediate pain, swelling, and rapid bruising. On the pain scale, I've heard it's a 10 out of 10. I've heard a patient once describe it like snapping a pool noodle in lava. Not sure how accurate that is, but it definitely sounds pretty painful. How common is this type of injury? It's fairly rare, only about 1,000 cases per year in the US, but it's definitely dramatic when it comes into the hospital, and I've treated it more than once in the emergency department. And remember, this isn't something you walk off. If this happens to you, you most likely need emergency surgery to repair the tear and prevent complications like erectile dysfunction or curvature in the future. Recovery lasts 4 to 6 weeks, and yes, you'll need to avoid arousing events during that time. Number 1 painful thing a male can experience: epididymitis or orchitis. Okay, let's talk about pain that's so intense that grown men have literally passed out from it in the ER. If you're not totally familiar, the epididymis is a tightly coiled tube at the back of the testicle where sperm is stored and matured. When this area becomes inflamed, usually due to infection, it leads to epididymitis. And if the inflammation spreads to the testicle itself, that's orchitis. So how do you know you have it? Symptoms include a sudden throbbing testicular pain that can radiate to the groin, abdomen, or even lower back. Some patients describe it as a bowling ball being smashed onto that area. Others say it's like a hot spike being slowly driven into their groin. Luckily, I've never had a personal experience with it, but it's also accompanied by severe swelling, often making one testicle look dramatically larger than the other, as well as redness, heat, and tenderness that can make even brushing against your jeans feel like handling barbed wire, because it can build slowly, drag on for days, and worsen with every movement and touch. So how do you get this charming condition? It can be caused by bacterial infections, often from UTIs or STIs like chlamydia or gonorrhea, as well as prostate infections or even prolonged pressure. Think extended bike rides or heavy lifting scenarios. Treatment includes antibiotics, pain control, usually with NSAIDs, scrotal support, and rest. I'm not gonna lie, recovery can take a while and the pain doesn't vanish overnight. There you have it, 5 of the most painful, terrifying, and unforgettable things that can happen to a male body. If you've cringed even once, go ahead and hit that like button and binge watch this entire playlist right here for more painful ER issues. Make sure you subscribe and turn your bell notifications on. That way you don't miss a single video. Thanks for watching and stay healthy, my friends.